Hello, this is Caroline. Today we will continue on part 5 of reproductive issues or maternal health. We will start off with the question. A 46-year-old visits her gynecologist because she has been spotting. Now, which pattern of vaginal spotting would be most suggestive of cancer of the cervix? A, on a rising, B, when sitting, C, after intercourse, or D, when climbing stairs. I will give you a moment for you to come up with the answer. You have to consider several things: the age, spotting, and cancer of the cervix. All right, and the correct answer is after intercourse. Now you're wondering, how did we come up with that? Well, the information that we will discuss on this video will tell us more. So today we will start off on hysterectomies. Now, hysterectomies, it's a procedure where they take out the whole uterus. Now, it could be because of several reasons. One of the things that is a challenge is myelomas. Myeloma is when you experience fibroid tumors in the uterus. And this is a very interesting disease because it causes a lot of discomfort. It causes a lot of pain. Sometimes it gives you backache, and that's why it's always considered like the fake pregnancy, because as it grows, as the myeloma grows, you start to present like someone who is 5 months pregnant. It is painful. And the interesting fact about myelomas is that after menopause, myeloma shrinks, and the reason why is because the hormone levels have gone down, and so it doesn't have that additive factor, and so over time it shrinks, and you don't experience it anymore. However, because of the pain, the discomfort, nobody wants to wait that long, so most people end up doing surgery as an option to get rid of it because it's annoying to live with it. The other one is cancer of the cervix, the ovaries, and we just talked about the uterus. But now, the worst one of all, can you guess which one? It will be the cancer of the ovaries. That has the worst prognosis of all, because the whole issue when it comes to cancer is early detection. And so some of this, like for example, if you experience the myeloma, you'd see patients having distended abdomen area. But this one, cancer of the ovaries, it's very hard to detect, and by the time you detect, it's late detection, and the disease has progressed a lot, and sometimes at that point, even if they do intervene, the prognosis is very poor. A 30-year-old woman has had a hysterectomy with bilateral oophorectomy and salpingectomy yesterday. Now, her immediate post-op course was on the uneventful side. She now calls the nurse and says that she is burning up and can't cool down, even though she has soaked her gown with sweat because she's just continuously perspiring. Now, the nurse knows the most likely cause of the symptom is which of the following? Okay, the first one is wound infection. The second one is surgical menopause. The third one is post-anesthetic syndrome. And the fourth one is normal post-operative responses. I will give you a moment to come up with the answer. And the answer is surgical menopause. You wonder why. Now, they did his salpingectomy, where they took out the fallopian tubes because they said it was a bilateral surgery. They took out the ovaries, and so what happened to her hormone system, her estrogen and progesterone? The levels dropped. Now, the other thing is when those levels drop, then they start to experience hot flashes. And hot flashes are also called basal motor instability. And so what would be an option for her in terms of management for that? Now, some people do end up opting to have ERT. ERT is estrogen replacement therapy. And the problem with that, or hormone replacement therapy, the only problem with that, anytime they do estrogen replacement therapy, when we were discussing about breast cancer, we talked about estrogen replacement being a fuel for breast cancer, and that's why, you know, some of those patients are put on tamoxifen. So that hormone replacement, I can tell you for a fact that uterine cancer has been promoted when they do estrogen replacement therapy or hormone replacement therapy, because you always need, as a woman, you always need both the hormones, both the estrogen and the progesterone, to balance each other out. And so when you just have one, then the outcome sometimes might be a little too tricky. Now that we talk about estrogen, for some reason, now there has not been like true founded research on this, but for some reason most women start to experience things of cardiac related after menopause. So there has always been rumors of, does estrogen help protect a woman's heart? Because during menopause, when the hormones drop down, that's when they start to experience the heart issues, stroke issues, and things like that. Now remember that high levels of estrogen can put you in the level of risk for clots and DVTs and stroke, and especially when your levels are much lower. The other thing that you will experience when you go through this hot flashes, and if they have taken out your ovaries through oophorectomy, is vaginal dryness. Now, there are different things out there in the market to help manage that, and I always want you to remember that in your uterus you have both the estrogen and the progesterone. And so that's why when we talk about doing the replacement therapy, you have to discuss with your provider what the best option for you is. A 47-year-old has had menorrhagia for the past year. She comes in for the annual exam complaining of fatigue, and she asks the nurse, what could make her so tired? So, what is the most likely cause of her fatigue? We have 4 options. Option 1, the lack of sleep that she has been experiencing. Option 2, decreased stimulating as she is aged. She's 47. Okay. The third option is less oxygen supply available to the tissues due to anemia. Or number 4 is medication used for this condition causes fatigue. Now, we have several things here to consider. Age, she's 47. Menorrhagia, we need to know what menorrhagia is, and the cause of fatigue. Now, I'll give you a moment. And the answer is number 3. There is less oxygen available to tissue due to anemia. She's losing so much blood because of menorrhagia, and that in itself predisposes her to anemia. Anytime your hemoglobin levels drop or the amount of red blood cells drop in your system, symptoms like fatigue are bound to happen.